Well, welcome. Thank you so much for coming to our very first wellness seminar at Warner Orthopedics and Wellness. I'm super excited to bring this concept to the community and to my patients. This has been a dream of mine for years. And tonight I'm going to introduce a new member of my team, Sarah Balladares, and then also tell you about what we're offering. We're bringing total wellness to you in addition to good orthopedic care. We're going to bring holistic wellness coming from yoga to massage to infrared heat, IV infusions to aesthetics, to good musculoskeletal care and functional training. So what we're going to do first is talk about Sarah and her program and how we're going to incorporate aesthetics into our wellness program, because if you feel like you look good, odds are you're going to do more to care for your body, care for your mitochondrial health, cognitive function, your physical health, your connective tissue health, and this has been shown over and over again in science. So I'm a big fan of total wellness. I'm Dr. Warner, as I said, and I'm an Air Force veteran, and I started this practice in 2013. We just moved into this new space, which is letting me do this whole wellness concept, which I have not been able to do until now, so I'm super, super excited. So what you're going to find here is we have a highly trained staff. We're all motivated to help you get better. Our goal is non-surgical care and improvement. We're big believers in natural health, herbal remedies, improving your vitamin and basic mineral status, things like that, optimizing your health. And like I like to say, for me, I want optimal aging. I don't want anti-aging because technically that's death. I want optimal aging. And that's my goal, is vital, healthy, functional aging. And that's what we're going to bring to you in the community. So tonight we're going to talk about aesthetics, which is an important component of that. And these are easily treatable issues, if you will. Wrinkles are just rhytids, and it's just a muscular action on the face, very easily treated with science. We're going to talk about that, and you can do it safely, and you can do it either minimally or maximally. My preference is minimal, but some people like maximum, and we're going to talk about how you do it. So we're going to talk about Botox and fillers specifically for you tonight. Botox is interesting because for me, as an Air Force veteran in the military, it's fascinating because the military is the first to isolate botulinum toxin A, which is what Botox actually is. Now, Botox is a brand name, of course, for Allergan. There are other brands that have different isolated proteins, but essentially it all comes down to the botulinum toxin that was discovered accidentally, like most things in medicine, at a picnic in Belgium in, I have to remember the year, 1895. People were eating raw salted pork and then basically died. They discovered botulinum. And that's where the toxin was first discovered. The military isolated the protein, Dr. Edward Chance in particular, looking for neurotoxins. And then the cosmetic utility of it was found, again, accidentally, like much in medicine, by ophthalmologists who were treating benign blepharospasm, which is just sort of like a benign muscular issue with the eye. What they noticed was that glabellar and different wrinkles in the face just sort of disappeared. And then all of a sudden we have the cosmetic utility, which is the biggest, fastest growing procedure in the world, really, if you think about it, and the way we can do essentially non-surgical facelifts now. So what is it? We talked about the history of it. Basically, botulinum toxin, or botulinum toxin A, is a protein that stops acetylcholine from being released at the neuromuscular junction. What that means is the nervous impulse that makes your muscle move, biceps, scapula, smile, forehead, is stopped by this particular protein. The protein stops the release of certain neurotransmitters and doesn't let the muscle contract. What is a wrinkle? A wrinkle is merely the opposite line relative to the way a muscle contracts. Sort of like if you bend your shirt, you're going to see wrinkles develop. Similar things happen with the skin. So if you can stop the underlying source of the bend, you won't get the discrepancy in the material or the wrinkle. That's how Botox works. Basically stop contracting, thus no wrinkles are formed. And that's what we're going to talk about tonight. Now, Sarah's going to talk about the artistry and the beauty of it. I'm a nerd and super interested in the science and the history of it. I've been dealing with muscle physiology, connective tissue, extracellular matrix, collagen, PRP, all of this stuff is all orthopedic. We are the masters of muscle and connective tissue. And I'll tell you that this is just basic muscle physiology, just different little anatomic body parts. Botox is awesome because you can not just treat wrinkles and muscular action. So for instance, we use it a lot in pediatric orthopedics for children with spasticity, like toe walkers. We put Botox in the calf muscle to calm down the action of the toe, the gastroc, so they relax and they can fit shoes better. We use it for migraine headaches to reduce tension, pull on the muscles. So not only does it do that, but we've also learned that it actually downregulates pain receptors. So it's actually a painkiller, and it downregulates the autonomic nervous system. So I use it for hyperhidrosis. So that means excessive sweating. So people that have excessive sweating of the armpits or the bottom of the feet or the palms, we can actually inject Botox into those areas, and then they don't sweat for about 4 to 6 months. And it's pretty awesome. So Botox has a lot of medical uses you probably don't think about, because the cosmetic use is obviously amazing. And that's what we're here tonight to talk about. We talked about muscle physiology a little bit. I'm going to talk about collagen and connective tissue too. Collagen is a protein. It's the basis of life. It's what builds us. Everything that lets me stand here and speak to you is collagen. It's fascia interconnected, providing tension and compression forces in the body that let me stand, move, function. And collagen is integral to the skin. In fact, 50% of all HA, hyaluronic acid, which goes into the moisture content of collagen, the moisture content of skin, is found in the skin. Collagen is a very important protein and sadly degrades with age, and particularly with UV exposure, i.e. sun exposure. This is why staying out in the sun, unfortunately, is so important. However, if you do that, you need to supplement with vitamin D3, but that's a whole nother talk. So muscle works with collagen together. You can relax the muscles with Botox, but it's irrelevant if you don't also supplement the collagen in the skin and give you that turgor, that moisture, that ability to withstand wrinkling. That's why we think Botox works best with fillers. We've learned that it's synergistic. They're great alone, but they're awesome together. So we like to do it both together, and then that way you can use less of each, which is nice too. And then basically, Botox is very, very safe. It's been used for years and years and years. You would have to take 3,500 units of Botox to have a really bad effect, and no one gives you that much at any given time. In fact, the cosmetic use is anywhere from 20 to 75 units at a time at the most. And in fact, if you use Botox over and over again, you'll actually weaken your muscles and develop atrophy. So in theory, you should use less and less each time over time. Studies have also shown that just using it once a year will actually decrease dynamic rhytids or dynamic wrinkles, just because just that one time of 4 months of no motion helps the collagen recover and heal and helps you prevent wrinkles going forward. So it's pretty awesome. It's great for wellness. It's great for soft tissue health, for collagen, extracellular matrix, tissue well-being, such as fascia. And it's also important for immune function. So skin, and now we're talking more about fillers with Botox, so I'm segueing into fillers. Skin is your barrier function. It's your primary immune. So to have good immunity, you have to have strong skin. You have to have good solid stratum corneum, which blocks bacteria and pathogens from coming in. And to have good strong stratum corneum, you have to have a good baseline of collagen underneath in the dermis and epidermis. So when you put filler in, obviously to help your wrinkles, what filler is also doing is building up the collagen layer and helping you have a better skin barrier. So it's actually good for your skin's immune function too, which is nice. And it also reduces the oxidative damage from the UV rays, which is helpful for anti-aging, or optimal aging, as we like to say. We're not really going to talk about platelet-rich plasma tonight. That's a different talk. That's my personal favorite. I've been using PRP for about 20 years now. PRP is an awesome natural way, using your own body's power to improve your collagen function. We do PRP injections and different topical applications of PRP here, but tonight we're going to narrow it down and just talk about the HA, hyaluronic acid fillers, and the Botox. And HA2 also includes, let me get back to the filler, sorry. HA2 is something that you may or may not have used in your knees, called Synvisc or Orthovisc. That's where I primarily use it in the orthopedic practice, but it's the same basic product. And it all comes from the first isolated find was in the red combs on chickens and roosters. That's why people sometimes call it rooster comb injections, because that's the most concentrated source you can find in nature of HA. Now it's synthesized in the lab, of course. But HA, which is filler, plus Botox, we think is the best combination to give you optimal aging of your facial structure and to prevent long-term dynamic rhytids or wrinkles and to help you age optimally and gracefully. And then that, in turn, we hope, will get you more inclined to take herbal remedies and supplements and antioxidants to prevent the oxidative damage to the rest of your body, such as your brain, your muscle, and your connective tissue, and to do things like yoga and functional fitness to get your body ready to take on this graceful aging that you're about to embark upon. With that, I'm going to introduce Sarah. She's a PA, a physician's assistant, surgical physician assistant, very highly trained in aesthetics and facial aesthetics. She's pretty amazing, and I'm going to let her take it on and talk about the artistry and how this really works in terms of making everything balanced and work better for you.
Okay. So I'm Sarah. Nice to meet y'all. Thank you for that awesome introduction, Dr. Warner. So like she was saying, I am an expert, I guess we'll say, in aesthetics, particularly facial balancing. I actually learned a ton from that, Dr. Warner, so thank you so much. Like she's saying, some people get a little bit nervous about, you know, oh my gosh, is 50 units too much Botox? I have, you know, 5 syringes of fillers, what you're telling me? She uses this stuff in her daily practice. There's kids that get like 300 units in their bicep muscle. 50 units a day is not going to bother you. So, like she was saying, we're going to go back to this slide. Hyaluronic acid, similar to other things used in medicine, you can use it in the knee, in any kind of joint. It's going to help to move that around. But in the face in particular, what this molecule does is hold on to water. So if it's holding on to water, it's going to fill your face in a very predictable way. So it holds about 1,000 times its weight in water, meaning that I can put some filler in the cheek, and we know predictably that it is going to give a nice, smooth OG curve, going to lift us, and it's going to give us the balance that we're looking for. Because really that's what is happening when we age, is that, you know, when we're youthful, we have this nice V shape. As we age, that shape starts to come down. So, you know, this fat pad starts to move down here, and you get that little chicken nugget down here. You start to jowl, your face starts to come down. It's very safe. It's easy to do, but you need someone that is very highly technically trained on where to put it and how to put it. All right, so like Dr. Warner was saying, Botox injections reduce wrinkles. If you cannot make the face, you cannot make the wrinkle. She said it way more scientific than I did. If you can't make the face, you can't get the wrinkle. So you move your eyebrows up, you make a mean face, you smile really big. All of those dynamic movements can be softened with Botox. Some people look at me and they say, Sarah, I still want expression. I still want to be able to move. And I'm like, cool, great. That actually tells me how many units I need based on me looking at you, as well as what your desired outcome is. And then fillers is something we use to, like I said, reduce the appearance of aging on the face. We can't stop you from aging. You can do everything in the world. There are lasers, there are PRP treatments, there are microneedling, there's threads. All of these things are going to help you look and feel better. But we want to make sure that we're doing it gracefully and we're doing it in the right way. All right, so who needs injections? Anybody who wants them? No. So if you're looking for a more youthful appearance and you look in the mirror, you're pulling. You're like, gosh, if I could just have this back, you probably need some cheek filler. Or if you look at yourself in the mirror and you say, you know, this is just really getting me, you probably need some filler. That's not to say that you may or may not need a facelift as well, but that's something that, you know, I'm here to determine and here to help you with. I want to make sure that we're doing the right thing in the right way, in the right timeline for you as a patient. If you want to enhance your facial features, so my 20-somethings who are looking at the Kardashians or looking at, you know, people who have these sharp cheekbones and sharp jawlines and they're very chiseled, or they have these great lips that they, oh my gosh, they come in and say, Sarah, I want these. Great. You also probably need some filler. And as long as, you know, we have realistic expectations, you and I can work together and figure out what's going to be the best thing for you. You can also use it underneath scarring. I use a technique called Subcision. Basically what a scar is it's kind of tethered down. So my acne patients, you know, when they get a scar that's kind of tethered, we'll use a needle, kind of break up underneath that scar to release some of that tension from the tissue. And then we can put filler underneath it to pop it out. And then we're looking at, you know, people who want to age out, what we talked about. So The biggest thing that I aim to achieve with my patients, I want you to look good. I want you to feel good. People will come up to me and say, gosh, Sarah, this is bothering me. But I've said, okay, does it bother you in the sense that when you feel like in pictures, you just don't look yourself? Do you feel like you look older? Do you feel like you look tired? I can fix the aesthetic part of it. I can fix the structure. But I want to help you fix what's going on in here and here of what's going on when you look in the mirror. And that's the biggest thing for me. I have moms that come back and say, I haven't made time for myself in the last however old the kids are, 8, 10, 12, 15 years, and I just want to feel like me again. And those are some of my favorite patients to treat because I know what I can do is going to help them to feel better. And then like Dr. Warner was saying, hopefully take that, and run with it. Exercise, eat right, PT, do the yoga that we're talking about doing. Get your IV treatments, everything like that. So where the injections can help, and this is where we're getting a little bit more technical in the sense that some people just come and say, I don't know what I need, but I know that I want to look and feel better. Great. That's my job to be able to assess that. So the place that we normally start is going to be the cheekbone. This is the building block for the entire face. You may come in and say, my nasal labial folds bother me, my Marionette Lines bother me, my jowls bother me, my under eyes bother me. Great. All of these areas are the cheekbone, so we can lift this up. I don't know if y'all can see. Tell me if I'm too close to this camera so I can show them.
Stop.
Okay.
Good.
So if you pull here, you see how this is improved, and this is improved. Now I have like 15 syringes of filler in my face, so it may not be the best example, but you pull on this and everything comes up with it. Now you put filler on the back side of the jaw at the same time, and it's going to lengthen that jawline and give that silhouette that we're looking for. We want to make sure that social profile, which is this is the one where you get caught in a picture and you're like, oh my God, who is that? I don't like that person in that picture. We work on the social profile. We work on the, in your profile, the one that you see in the mirror, as well as your 45-degree angle. I'm going to trip on this one. There you go. Okay. As far as Botox goes, if you don't like your wrinkles, I say treat them. All right. Some people are happy with their wrinkles. Some people are not. I'm here for both of you, right? The other thing that we need to talk about is making sure that we balance the face. And a lot of times I have patients who have TMJ or protruding masseter muscles. Those can also be treated with Botox. If you are clenching or grinding or have clipping, popping, or you just don't like how boxy your lower face is, Botox can treat that. I've had in the last year, I think 3 or 4 patients that have come to me telling me they cracked their tooth because of all the stress they've been under. And I told them to get Botox and they stopped clenching, stopped grinding. A lot of people will be prescribed mouth guards. We all know y'all spit those out at night. Those don't stay in your mouth. And what those are doing are actually just protecting your teeth, not necessarily fixing the issue that's causing it, which is the biting and the clenching. For my patients that want some lips, and sometimes for the ones that don't want lips, I can recommend lip filler. For my 20-somethings who just want a little want to look like their Instagram filters or whatever it is, yes, we'll put some lip filler in there for you, honey, I got you. But sometimes for my older patients, I'm talking my 50s, 60s, 70-year-olds who come to me and they say, my mouth, I have these lines all around and these sprinkles. Sometimes you treat that with Botox. I don't love it. For this reason that because you are stopping that muscle movement, sometimes you stop the movement of the upper lip too much and it just doesn't look right, when what you really need is just some filler in there. So if we think of the lips as a balloon, and we blow that balloon up, it's nice and it's smooth and it's got a really pretty outside. What happens when you let that air go after it's been kind of overblown up? It starts to wrinkle and fold in on itself, right? So sometimes we just need some filler in there to put it back to that smooth part. I'm not talking duck lips. I'm not talking anything that doesn't fit your face. I'm talking about just restoring what you had to make it look youthful. One of the most telling features on the face of aging is the distance from the tip of the nose to the top of the lip. If you go look in your mirror after this little broadcast and you say, gosh, I noticed that my lip doesn't have a little upturn to it anymore. that distance, the longer it is, the more it ages you. So we want to make sure that we're not A, overdoing it, but B, we want to make sure that we are giving you that youthful turnout that's going to shorten that distance and make the entire lower face look better. On the other side of that, sometimes people come in saying, I really want my lips done. And I look at them and I say, you know what, that's not the plan for today. I think that what we need to do is actually address what's going on around the rest of the face. So you may come in looking for something that you're like, you know what, I'm getting this today. These lines really bother me. I am getting filler right here. And I'm going to say, slow down. Let's talk about it. Let's assess the whole face. And sometimes we won't even actually treat this area, but we'll get massive improvement by treating a cheek, a jaw, a chin, and it all elongates and fixes the structural issues before I call them the tchotchkes, you know, of wanting, you know, this line right here really bothers me. When we can get more bang for our buck in the filler department by doing it in the proper order to get you looking the right way. Okay.
Yeah, there is a question.
Yeah, what you got?
There was one about the filler around, I mean, how to fix the mouth area, but I think you got that one. Then there's another one about Botox for migraines. Is that something you do, or is that just
Sure.
Dr.?
So Dr. Anderson does it, but I can speak to it a little bit. So first and foremost, I want to make sure that we're clear on how the process to get to Botox for migraines. You have to fail several other therapies, and by fail, I mean you took Imitrex, you took all these other medications to try to help your migraines, and they're just not working. For insurance to cover Botox for that portion, for the migraine all through here, you're going to have to go through a couple hoops. Now, if you wanted to pay out of pocket for it, there's also that. You can do that as well. It's usually anywhere from 75 to 100 units of Botox all throughout here, the back of the head, back of the neck, trap muscles to help with that. So yes, it can be done. And Dr. Anderson is the one who does it here. She's a specialist in that. Any other questions? Some of the side effects of Botox and fillers. There are really, the main one is going to be bruising. I always have to giggle a little bit to myself when patients come in and say, okay, I have an event this weekend and I don't want to bruise. I'm sticking a needle in your face. I cannot predict whether you were bruised or not bruised. I bruised myself. I bruised Dr. Warner the other day, but 99% of the time, you will not bruise. I just can't promise you that you won't, because that would be just irresponsible of me, honestly. The first time I inject you, I'm learning you and you're learning me. I'm learning your face. Everybody has, and we'll show you on the model that we're about to do, everybody has very nuanced movements in the face. And so when you really delve into this field of medicine, you want to make sure that you're understanding that my first time injecting you, I might not get it perfectly correct, but in 2 weeks, once it settles in, I will come in and we'll adjust as we need to, because everyone's got random little muscles that'll twitch a little bit differently, even from either side of the face. So you may be a little bit undertreated, you may be a little bit overtreated, but I usually tend to err on the side of undertreatment until we know your proper dosing for the Botox side of things. For filler, again, bruising is normal and to be expected, specifically on the lower face area and the lips. Very, very vascular areas. And I have to stick you a couple different times to make sure that we have symmetry and make sure everything's perfect. So again, I can't promise that you won't bruise, but I can promise that you're going to look really good. You want to do all of these procedures at least 2 weeks before any event. So I would suggest, your daughter's getting married next month. Come in, let's have a consultation. Let's figure out what you mean. Let's get it done. And I want you to have at least 2 weeks before that event so we can tweak if we need to. That's really all the side effects. Oh, you may get a headache. Post-Botox injection, I typically don't let myself get to this point because I am every 3 months or 3.5 months to the day on injecting my Botox. But if I wait a little bit longer, I say maybe 4 months, I personally get a little bit of a headache for about 8 hours. Some people tell me it's 2 days after injection. It's not bad, but overall, headaches actually tend to improve aesthetic Botox. So it's really a win-win situation. And I think we are ready for our model.
Hold on, there's 2 more questions.
There's 2 more questions. Okay.
Yeah, the just kind of reiterating the TMJ for Botox for TMJ? I think somebody missed it, so they had another question about it.
Sure. So is there a specific question or just want me to go over it again?
Literally, it just says question about Botox for TMJ.
Okay. So Botox for TMJ, there's a muscle back here. It's called the masseter muscle. A lot of people hold their stress in this area. A lot of my hairdressers bite down, and Dr. Warner bites down. I'll show you her masseter muscles. I'm ready to get my hands on them. A lot of people bite down and put a lot of stress and tension through here, okay? That can cause the TMJ because you're pushing that bone into its socket past where it's supposed to go and just constantly having that pressure on there. So we want to put the Botox in there to relax that muscle, to stop it from pushing as hard. It helps with the pain. It may not necessarily help with the clicking and popping in the TMJ specifically, but for my clenchers and grinders, it definitely does stop how hard it is, how hard you're clenching down. It doesn't affect the way you chew. It doesn't affect how you speak or anything like that. What it's really, the whole goal of it is just to relax that muscle enough to give you some relief.
All right. Can you do something for sagging eyelids?
Which sagging eyelids is the question. So depending on if it's your upper eyelids, we're going to assess that. Sometimes I'm going to send you straight out and say you need a blepharoplasty. So Botox can help depending on the stage of sag that you're having, but we're not going to fully rely on that if you're having some severe sagging. So I worked with plastic surgeons for years, and I could pretty much tell you, it's time to go get this checked out. It's that actually, we don't do the surgery, I'll speak to it. You can do it in office, some people do. It's a very easy procedure in the sense that it's just a removal of skin. It looks pretty bad for about 2 weeks, but my patients that get this done love it. It is life-changing. They can see again. That's for the upper lids. You can also have that surgery for the lower lids. If we're talking about sagging for the lower lids, are we talking about a bag? Are we talking about a tear trough? That is my arena. I can help you out there. Again, I may refer you out. But when we're talking about under eye filler, I typically want to suggest that we do cheeks first. If we do the cheeks first, then we can get that lift and the support through here. Your whole face is made out of fat pads. And so as we're aging, those fat pads separate, recede. When we put that filler in, it's going to lift and put them back where they belong. So if that fat pad just needs to be camouflaged a little bit, because that's what this sag is down here, if it needs to be camouflaged a little bit, we can put the filler in the cheeks and do a little bit through here, and maybe some laterally if we need to camouflage that for us.
And then the next one is what kind of costs are involved in treatments? I realize that it'll vary, but just an idea.
Sure. So we charge $13 a unit. I think we do have a special going on with this event, so stay tuned for that. But I charge $13 a unit for Botox. And for filler, it varies. So you're looking at anywhere from $650 to $900. But we're going to decide that together on what filler is going to be best for you, because you can't just say, oh, I want filler. We can't put the same filler in the cheek that we put in the lip, that we put in the jaw, that we put in the under eye. So we're going to decide that together. What's going to be the best path for you, and what's the best way to achieve it? So anywhere from $650 to $900. I typically, if you are, and this is a huge generalization, if you are over 40, I'm probably going to tell you that you need at least 3 syringes to start. And again, we can decide which 3 syringes those are going to be, but it's probably going to be your cheeks and the back of your jaw that we're going to start with.
All right.
Good on question?
It's good right now.
Awesome. All right, so we are going to start with our live injection with our lovely model. I'm actually going to show y'all, I don't typically mark on people in clinic, but I will mark on her to show you the differences on how her face moves versus how someone else's face moves. And I'll show you exactly where we go with those injection sites. So if you want to talk about that. I'm so excited. I know. You want to be my assistant? Sure.
Oh, that's fine. I'm fine.
Is she sure?
Are you cold?
You want to? Oh, well, yeah. And then she can hold up. Whoever wants to assist. Yeah.
You don't want to? No, I do.
Okay. Actually, I'm gonna sit things in your lap is what we're gonna do.
Okay.
Okay.
Nadia's gonna assist you.
Wonderful. I think Jamie's got it though. We'll find out. We'll see if we got this. Not your first rodeo for this?
Not with you.
No, with me. Okay.
Let's go to medical school.
Oh, okay. Hold on. All right. So obviously, we're gonna clean you off to go. When's the last time we had Botox? Let's see. Last time I did it, so a couple months ago. And if y'all have questions, please ask. So I cheated. I kind of know what I want to do for her already, just because she's already a patient of mine. But I will mark it out for y'all. Okay, thank you. All right. So the first thing we're going to do is we're going to assess her face. Your face is so perfect, you're right. All right, so the first thing I always do is assess, okay, what areas are you concerned about? And we know it's all of them that we always do. So go ahead and raise your eyebrows up for me as high as they go. Good. So she's got movement all the way up in her forehead here. There we go. Okay. So we're gonna hit all of these spots and maybe hit a little dot right there, right there. All right, make your mean face for me. Good. So you'll see how that muscle pulls in all the way. Go ahead and do it again. This corrugator muscle pulls from here to here. So we're gonna hit all the way over. And her procerus muscle is the one that pulls down right here. So we're gonna make sure we get that as well. All right, and small really big for me. Good. Now Jamie likes a little bit of a brow lift. Jamie does not have sagging lids, so we don't necessarily, I'm not concerned for, for that portion of things. But what we're gonna do is with this brow lift, give her just the tiniest little bit right here. All right, and then pull down for me. Yep, good, relax. Sometimes these muscles down here can pull the mouth down. So the marionette lines are what this calls it, the marionette lines rather. So when we relax this muscle, what it's going to do is slightly turn up the corner of the mouth for her. So we don't need to do filler there just yet on her. And then when Jamie talks, her mouth, her chin kind of squinches a little bit. So we want to make sure that we handle that as well. Okay. So we'll get our Botox together. So there's different dilutions and for different things. I typically do a 2 ml dilution. I don't know if that means anything to y'all, but there's hyper dilute, there's regular dilutions. There's all kind of different ways to do this.
Sometimes over diluted.
Sometimes it's
By unscrupulous.
Yeah. All right. So in your opinion, Jamie, does Botox hurt?
No. I mean, it just feels like a punch.
Yeah.
And then it goes away. But I have a pretty high tolerance.
Me too.
And you know what? Beauty is pain.
Beauty is pain sometimes.
But can I speak to that?
Sure.
The pain aspect. I'm gonna stand next to the mic.
Sure.
I don't know if everybody can see me. No. I inject people all the time in clinic, and we use anything from a 22 gauge to a 27 gauge to a 25 gauge. But when I do very superficial tendons or very superficial painful areas in the body, I'll often use a Botox needle, which is a 30 gauge. And the 30 gauge, most people don't even feel, quite frankly. So it is, you feel it, but it's not, it doesn't hurt like a normal injection hurts. And just so you know, it's totally backwards in medicine. The higher the gauge, the smaller the needle.
Yeah. Okay, so for Jamie, we're gonna do 10 units around the eye. So 10, 20,
even with her face.
30.
What's this? Oh.
what's that? 45. What's that? Okay.
And we're gonna do 15 units on her forehead as well. All right, Mama, you ready?
Yep.
Okay. I'll help you out here.
Little
bug.
She's
Good job. How we doing? Just like you.
I've heard that Botox does not leave the body. Is that truth or myth?
That is a
That's-
myth.
I can speak.
Oh yeah, go ahead, Ron, exactly. Please speak to that.
Yeah, so Botox has a short half-life, actually. It binds the vesicles in the presynaptic neurotransmitter and prevents the release of the neurotransmitter that goes into the synapse to go to the postsynaptic receptors. And that nerve is irreversibly stopped from functioning. However, after about 28 days, the body sprouts new nerve endings and the muscle recovers fully in 3 to 5 months. And there is no detrimental effect long-term to the muscle or any of the surrounding structures.
The short answer is
No.
you're not. No. Crushing it. So Dr. Warner likes to use a 30-gauge needle, and I'm nicer and like to use a 32. 32 is actually a smaller needle than what she uses. So it does feel like a little pinch, I'm not gonna lie, but it's nothing that you can't handle.
Even better, Dr. Anderson, when she does the migraines, uses a pediatric 35 gauge.
I need that. I'm gonna be nice like that.
I'd like for you to be nice.
You wanna be nice? Okay, Rachel's eyebrows up one more time for me. Good. Okay. Is there any way to show a little bit closer on Jamie's forehead? Yeah, I know. Get really close. So Jamie has some lateral folds
You can go
that
closer.
we really want to make sure that we address. So
That's
when
good.
people get stocky eyebrows,
That's
so raise your eyebrows up, she's prone to this because if y'all notice her muscle right here, I know this is hard to hold. Her muscle right here, which is the frontalis muscle, kind of makes a curve and also pulls this way. So if you have somebody that you see with that spocked up eyebrow, it's because this was not treated out here. So you want to make sure that, you know, and I always make sure that when I'm assessing my patients, I'm looking for these nuances. I'm
Right.
looking for every little spot where we could run into trouble. So, okay, Rachel, that's it for me. So, go back.
Sarah, the audience is seeing your hair.
Flip your, yeah.
Oh, flip my hair's in the way, all my extensions. Okay. It's a weave, it's fake. Here we go.
Sarah, speak to the fact that you should not lay down or massage. Let it spread itself.
Yeah, so kind of old school mentality actually is,
I am old school.
yeah, so there's that. You're not supposed to lay down for 4 hours. You're not supposed to go work out, which I do believe in that one. Old school says, oh, you have to move your muscles around afterwards for 20 minutes. It's gonna go. It's gonna be fine. You're gonna be okay. But what I will say is that I do not want you working out after. I don't want any sweat. I don't want any. I am a burpee hater, but I do them. But I lay my face on the floor when I'm doing it because I get a little tired down there. Don't do that. Don't get any dirt in your face. Don't go work out. Just for that afternoon, you can return to your life as normal. There's really no downtime with this or with filler. Pull down for me again. Good. Relax. This is the one that I love. I love this little injection. I'll come right to the other side so my hair's not in y'all's way. Okay, pull down again. Good. Good. Good.
How about dark circles under the eyes?
So we can treat those in 2 ways. So it depends on, do you actually have dark skin or do you have an actual trough, a hollow? And I'm going to use you because you're sitting in this chair. You don't have that, but let us stay. And one more little stick right here. And she's done. How are you feeling?
Amazing.
Amazing. You're so happy.
I feel 20 years younger.
You're so happy. Love that for you. I do love that. So as far as under eyes go, because Jamie's sitting here, Jamie does not have hollows under her eyes. She's good. I actually do, and I get filler under my eyes. But it depends on, do you actually have dark skin? Bleeding a little bit. Got a little dripping. Do you actually have dark skin, or is it just a hollow? Is it a shadow created from your brow? Those are all things that we are going to address in a consultation. So when I'm talking about, hold on to this, let's get your blood out. Oh, you got to go on, perfect. When we talk about under eyes, we want to assess, I'm going to pull it down. I'm going to see what kind of turgor do we have here. What's your skin? Is it very crepey? Does it need maybe a shot of Botox when you smile? Does it kind of pull in? My eye pulls in a little bit when I smile. Okay, you said it, not me. It's a little crepey, but she does not have actual hollows here. So we're going to assess. Sometimes people, their brow bones protrudes a little bit further than most, causing a shadow. All of these things are typically addressed with a little cheek filler. So you're going to pull this up through here. Look, you're facing that little bit this way. So you're going to pull up through here, and what's going to happen is this area is improved with the cheek filler. This is improved. This is improved. She need under eye filler at this point if she were a patient that needs it. I had one the other day. She really wanted under eye filler, and I said, well, let's try the cheek first. And then let's see where we get. We did her cheekbone. Her under eye problem went away. Her nasolabial fold problem went away. And so so that's how we do it that way. If you have actual dark under eyes, this is for my people of color. African American people get it. A lot of Middle Eastern people have actual dark skin here. What we can do for that area is use PRP, and we can, if they have an actual hollow as well, we'll mix the PRP with the filler and insert it with a cannula. So super safe, one hole to get in there, one port site, and we'll cannulate through with the PRP and the filler. The PRP is going to brighten the skin for us because it's got those healing factors inside of it. I think that answers the question.
Yeah, she said she just looks tired. So.
Okay, so she's probably going to need what?
Rule out anemia, another reason.
Well, of course, yeah. So we're going to rule out the other medical root causes as well. And that's Dr. Warner's job. No. But if you feel like you just look tired, you're probably just going to need cheek filler. If you're a younger patient, come on.
Oh boy.
We're involved now. We're all here. Gang's all here. This is Nadia. She's a younger patient. Nadia probably does not need cheek
She's not a patient. She's a medical student.
Well, yeah.
Future.
Go
So Nadia
move
does
her
not
a little
need
bit
cheek
this
filler.
way.
She's got beautiful, beautiful cheeks.
Just a
This way,
smidge.
that
Okay.
way.
Okay.
She's got beautiful, beautiful cheeks. But she does a little tiny bit of hollowing right here. You put a little PRP in this little baby's face, and she's fine if she needs it. She's gorgeous. But if you're feeling like you are Nadia's age and maybe I just look a little tired, maybe some PRP, maybe some filler. If you are, I have under eye. I just slapped the mic. I have under eye filler. Sorry, y'all. And I am 31 next month. Yep, I'm 31 next month. I'm doing that. And I've been getting under eye filler since I was 26, as well as cheek filler, just because I look tired. The other contributing factors of needing filler, weight gain and loss, stressors in your life. Are you staying up all night with a baby? Are you staying up all night with your mom who lives at your house now? Things like that. So all of these different factors go into it, and we're going to address all of them. So, another question.
The specials, they're up on the screen. So
Your
this-
screen.
this
Your
screen.
screen. Got it. So the specials that we're doing we're going to do, if you buy 40 units of Botox, changed it. I don't think it happened. 40 units of Botox, you get 10 free. So on Jamie today, we used, 15, 30, we used 55 units on Jamie today. So I don't always do the lower face. So 50 units is going to be where most people need to be. We're doing 40 units of Botox or any neurotoxin, you get 10 free. And then we're also doing a really great special, which is buy one syringe of filler, get one half off. And that's a massive savings, up to $450, depending on which fillers that we use. So if y'all have any more questions, I'm sorry, I haven't been paying attention to my questions on Instagram Live. I apologize, y'all. We also do in the next 2 weeks, Dr. Warner wants to say hi. In the next 2 weeks, if you schedule an appointment with us, you get 10% off. But if you bring a friend with you to your appointment, let me know first. I'll show up with you, boo. If you bring your friend with you to the appointment, you'll both get 20% off with the service. So if y'all have any questions, let us know.
And then getting in touch with you.
Yep. So you can find me. You can either call Dr. Warner's office. You can call my office. You can find us on Instagram at Smooth by Sarah. If you want to text me, you can, 504-250-5291. You know your office number?
724-8888.
Okay, 225-724-8888.
754-8888.
Oh, Natalie says 754-8888.
I said 754.
I said two.
You said
Anyway,
Sorry.
225-754-8888.
we love being with y'all this afternoon. Thank y'all so much for joining in. Dr.
I got the
Warner.
winner.
Oh, we have the winner of
You got the
our
winner from the
30
event.
free units.
Move over this way.
Am I okay?
No,
Jamie,
you can stand up. You just need to move.
All
this
right,
way.
thank you again for agreeing to model. for
Yes,
us. That is
Jamie.
very brave and really nice of you, so thank you. The winner is Jacqueline Walters. So we're very
So
excited to
excited.
say you're going to love Sarah. She's amazing. And we're very happy to get you your 30 free units.
Sure.
Looking forward to it.
All right, y'all. Have a
Thank
great
you
night.
so much
Be
for spending
safe.
time with us.
Yes, we appreciate y'all and have a good one.